So migraine is a specific kind of headache that's characterized by pain that's usually on one side of the head, usually throbbing, usually severe, and always associated with other symptoms, sometimes nausea, sometimes sensitivity to light, sometimes sensitivity to sound. Migraine occurs in about 12% of the population. It affects 18% of American women, 6% of American men, so it's one of the most common disorders that people experience. A typical migraine attack lasts from 4 to 72 hours, and many people who have migraine are disabled by their headaches, unable to work or take care of their families when a headache strikes.
Together with our patients is headache, but you don't have to have headache to have migraine. About 20% of people with migraine have something called an aura, which occurs often before the attack, commonly something in their vision, but sometimes numbness or difficulty in speaking or weakness or even paralysis of one side of the body is possible. That's commonly followed by a headache. The headaches are of a whole variety of types, and they're often associated with symptoms like sensitivity to light, sensitivity to sounds, sensitivity to smells, nausea and vomiting. But you don't have to have the whole constellation to have migraine.
We do not know the cause of migraine, but we do know that a migraine is not just a headache. It is a rather complicated combination of chemical and electrical events in the brain, resulting in headache. Many parts of the brain are involved in migraine. It is believed today that certain vessels outside the brain become inflamed and that inflammation is what causes the pain. Migraines are hereditary, meaning certain signal molecules in the brain and the way they are channeled appear not to work smoothly in affected members of migraine-prone families. Almost every 5th woman and every 10th man have migraine. They are frequently undetected, and some people spend years suffering because they do not know that they have migraine.
So some tips that you can take, to prevent one is, of course, first and foremost, take good sleep. It is actually very important for people who have migraines to take at least 7 to 8 hours of good sleep. And you should try to sleep at the same time and wake up at the same time. This helps prevent the brain from undergoing major changes due to the sleep cycle, and hence that way you can prevent a migraine. Next thing is, make sure that you're drinking enough water. A lot of times people, especially in this heat, they may not drink enough water, and that is a very common cause. When they go out in the sun, they end up feeling dehydrated and end up having a migraine. So make sure you're well hydrated. At least you're drinking 2 to 3 liters of water every single day. Third thing is, try and avoid stress. Of course, that's easier said than done on any day or time, but what you can do is, try and practice meditation. More specifically, the data is great for mindfulness meditation. Even 10 minutes a day that you take out for meditating can really help decrease the incidence of migraines. Because what it does is, it helps calm those brain chemicals down that typically, get going when you're having a migraine. So meditation is something you should definitely try and do. Try and limit your, caffeine intake. Typically avoid not more than 2 cups of coffee or tea a day. And foremost, of course, exercise. Exercise is very important. 30 to 45 minutes of exercise a day really can help prevent a migraine as well.
So migraines and migraine research is a huge field, and there are always new treatments being developed. One of the more recent treatments that was approved by the FDA is Botox. Botox for migraines, we don't understand exactly why it works. My perspective, though, as a surgeon, is it paralyzes the muscles, and those muscles are muscles right around nerves. So for example, in the forehead area, there's nerves that run right through the muscle there. And so some people that get Botox for cosmetic reasons, for the wrinkles there, actually cure their migraines that start in that area. There's patients where I will treat them for migraines with Botox in that area, but also in the temples or the back of the neck. And once again, my perspective there is that the Botox paralyzing the muscle in an area where the nerve runs directly through the muscle then prevents the muscle from causing chronic irritation of the nerve as it squeezes or pulls on those nerve branches.
So after speaking with her about the process and informing her about all of her options, like we do with all of our patients, we elected to go ahead and provide the Botox treatments for her migraine headaches as a treatment option, as well as an indicator of whether or not she would be a good candidate for surgery and the permanent relief of her migraine headaches. And thankfully, she responded incredibly well. So after she responded well to the Botox, we then moved on, did the surgical procedure. And during the surgery, we made certain incisions, well concealed, cosmetic surgery type incisions to gain access to those nerves beneath her skin that were being pinched by the muscles. And we released and decompressed those nerves that were being pinched by the muscle. We did this both on the front of her head as well as on the back of her scalp. Afterwards, she's had incredible results from the surgery. Initially, which is true of a lot of patients, they'll still have a migraine or two for the first 3 or 4 weeks because surgically we were near the nerves and irritated them during surgery. But since then, she's done incredibly well.
Migraine cure does not exist, but we do have many effective treatments that will bring your migraines down to minimum. Maybe you'll get one headache every few months, possibly, maybe less than that. I cannot promise that everyone can do that. Everyone can achieve a cure, but there are many treatments that we recommend. And my usual list of treatments that I give to many of my patients, not all, and we adjust that, include lifestyle changes, elimination of caffeine, smoking, regular exercise, relaxation training such as biofeedback, meditation, supplements such as magnesium, riboflavin, coenzyme Q10, feverfew. We often give Botox injections. For some people, that's a miracle cure. We use acute therapies like Migralex that we've developed at the New York Headache Center and other prescription drugs that can be miraculously effective. It's not a true cure, but it can make a dramatic difference in your lifestyle.
Home remedies for migraine. Remedy number 1. This is a very simple remedy. You take half a cup of spinach juice and then you add about a cup of carrot juice. Let's mix this well. Drink this to get relief from your migraine. Remedy number 2. In this, we take a quarter cup of cucumber juice. Now let's add a quarter cup of beetroot juice. And finally to this we add half a cup of carrot juice. Let's stir this well. And our home remedy is ready. Drink this to get relief from your migraine. Remedy number 3. This is a very simple remedy that you can do at home. What you need to do is just take a few lemons that may be lying at your home, cut off their peels, put them into a mortar, grind them very well, and then take that paste and apply it to your forehead as a plaster. This will give you relief from your migraine.